the fact that it is acquired through the blood. And so here we're talking about when parents, that's how can you say it's inherited. So when people marry and the woman conceives and they are both having the sickle cell condition, then the child will be sickled. Am I right?
Okay, so if we go back to that, what happens is that for you and me, we all inherit genes from our parents.
Okay.
You inherit one from your dad and another from your mother. And so if you inherit even one abnormal hemoglobin gene from your father or your mother, and then one is S, you can get that sickle cell disease that we are speaking about. So let me go back. They are different abnormal hemoglobin. It's not only sickle cell, but sickle cell is the one that causes lots of problems. So apart from the S that we are talking about, we have what we call hemoglobin C, hemoglobin D. They are all abnormal hemoglobins. But anytime that you inherit two of these abnormal hemoglobin genes, and then one of them being the S, then you are called a sickle cell disease.
Okay, so but again, I know that there are people who are AS, others who are SS. So help us with some education on the AS, the SS, and who cannot marry who.
Okay. So, the different types of patients with sickle cell, we have the SS, they have the sickle cell disease. We have the SC, they also have the sickle cell disease. And then we have what we call S beta thalassemia, they also have the sickle cell disease. In case you have AS, AS is the sickle's S trait. S trait, you are a carrier of the abnormal hemoglobin, but you don't have the disease. But you have the potential of giving it on or passing it on to your offspring.
That's somebody with AS.
With AS.
Okay.
So you can pass the S on to your offspring. So your child can get the S from you. We have another one which we call AC. AC also, you don't have the disease. You have a hemoglobin C trait. And you will have a normal life. So those with AS and AC normally are okay. They don't have any problem. But the problem comes when you have some of these people who have the traits, and then two traits decide to get married. They will come to you and tell you that, oh, I don't have any disease. But when I gave birth to a child, they told me that my child has disease. Because possibly one of the parents gave the S, and then the other one also gave the other S or the C. And so you get a child with an SS or an SC.
So